obviously a really pertinent issue for all companies to be aware of, but it's something that global companies in particular need to think really hard about. Things can get a lot more stressful when you throw in different time zones, communication styles, and cultural expectations. And in fact, I'm just going to ground this session with a really interesting piece of recent research that I found from SHRM, showing that fully remote and hybrid work models are more associated with increase of anxiety and depression compared to in-person work. And I know, there's a debate to be had around both sides there, but we're just interested to dive into this discussion with these two amazing experts and look at how HR and leaders can support their teams. So I have here with me Aditya Rao from Multiplier. He's the Director of Total Operations, and he oversees the design and implementation of compensation and rewards philosophy for our own employees internally. And he's got great experience in designing and implementing compensation and benefits, and also looking at the technology and people analytics side. Aditya, would you like to introduce yourself?
Yeah, happy to be part of this enticing discussion on mental wellness, which I guess is being a day in my role here at Total Rewards and HR Operation virtually means that I'm designing compensation and aligning compensation with the organization's objectives and goals for the future, and as well as designing the insurance and the benefits package for our employees at Multiplier globally. Along with that, I also lead and I'm in charge of designing the employer experience from hire to retire here at Multiplier and lead the HR technology and the HRIS implementation here.
Amazing, thank you. And I'm also really excited to introduce Dr. Oliver Sunderman. He's the Vice President of Clinical Intellect. Now, to give a bit of background, Multiplier, as an EOR, we partner with Intellect to provide comprehensive and culturally relevant mental health support to our global network. But to give a more context about Oliver, he's a clinical psychologist by training, and he's overseeing the clinical governance, services, research, and product innovations over at Intellect. I'd love if you could give a bit more background on Intellect and your own history there, Oliver, as well.
Thank you so much, Bev. Thank you for having me, and really excited to be here. It's such an important topic. Intellect, so we are... We see ourselves as the global leader in hyper-localized mental health care. So we are a mental health care and also technology company. We support over 4 million lives globally across 120 countries. We're available in 100 plus languages. So we really are quite localized because we do believe that mental health is a very nuanced topic. And we want to provide care that's culturally attuned, that's provided in the local language of the people who use us. High level, our mission really is to make mental health care more proactive, culturally attuned, and really accessible at scale. We started out 5+ years ago out of Singapore, and we realized that access to care is really quite restricted. There's so many barriers to do with stigma, to do with cost. And also there's been quite a focus on more reactive care. So companies oftentimes provide through employee assistance programs a safety net, usually in the form of a helpline and therapy sessions, but that's usually quite reactive. We also do that at Intellect, but we also want to help employees to build up more proactively their resilience. So we offer self-care, guided content, and coaching as well to help people with sort of everyday emotional needs to be a bit more proactive about their care. And we do a lot of organizational insights, and we have a lot of innovations around AI as well. So very, very happy to dive more into those later on.
Thank you so much. Yeah, I'm really interested to hear more about that AI piece. But just piggybacking off what you said there about that kind of reactive or proactive approach, I think the first area that I kind of wanted to explore is burnout. And that's the thing an issue where companies really need to be more proactive, and they need to be spotting it and also preventing it. So I'm just going to give a quick definition of burnout, and then I'd love to hear from you both. Like how can managers and also HR teams spot the signs, and what can they do, and like what does it fundamentally come down to prevent burnout? But just for anyone who might not be aware of the term, the World Health Organization defines burnout as resulting from chronic workplace stress that's not been successfully managed. So it's characterized by these 3 criteria, which is feelings of energy depletion or like emotional exhaustion, increased mental distance from your own job, just feeling like less interested in it, and like feeling like you're not as good at work basically as you were before, less competent, less successful. So they define that as reduced professional efficacy, which is a slightly complicated term. But yeah, I would love to hear from you both. I don't know if Oliver, you want to start, just linking back to what you just said.
Yeah, obviously burnout is a very huge topic now, and something we can't take serious enough. I think there's a few angles here. First of all, you need to have a way, companies, HRs need to have a way of measuring burnout, so they know the level of risk in their teams, in their company. So that's number one, which is why we have built our own proprietary burnout screening tools at Intellect. So we do partner with HR via our tech platform to encourage employees to answer questions around burnout, their workload, their work-life balance, and so on, so that we have data to start with. And then we give the organization insights at the aggregate level, how certain teams are doing. So that's something we can measure. Insights is one thing. The other one is actionables. What are you actually going to do with those insights? What can managers do? What can HRs do? This is where manager training comes in. You don't know what you don't know. So we do a lot of mental health first aid trainings for managers, for executives as well, to help team leaders to have safe conversations around mental health. To first of all, equip managers and HRs with the basic skills around mental health. So to understand, what does burnout look like? Or what does depression look like, or anxiety? And oftentimes, especially in remote teams, it's more around silence and people disengaging, and it's not so easy to spot. And it's also not so easy to have a conversation that feels safe for the employee as well. So if you ask someone, how are you doing? The standard answer is, oh, I'm fine, or I'm busy. But then staying with that and diving a bit deeper, how are you really doing? And or being more upfront as a manager. Hey, I noticed you missed a couple of deadlines, and I'm really concerned about your well-being. Or I noticed you've been coming to work a little bit late recently. Are you okay? So it's two things really. It's having some data, but then importantly, equip managers with the skills to identify those signs, and then as and when needed, also make referrals to coaching or clinical services.
Adding on to what Oliver's already pointed out, I think with the advent of remote and hybrid work, the lines between work and family time and me time can blur very quickly. So as our leaders and as HR professionals, I think it is important to identify and stay vigilant in identifying early signs of burnout, right? It might be like Oliver pointed out, team members being disengaged, being early or late to work, and closing later in the day. It can also be withdrawal from team interactions and showing signs of irritability. So the first and fundamental thing to address burnout is identifying, and we as managers, leaders, and people function members are the first and at the forefront of this.
Yeah, and I'd like to add to that point as well, is the whole idea around psychological safety. So if managers and companies want to identify burnout, they need to create a culture in the company and especially in their teams that feels safe enough for employees to be forthcoming as well when they do struggle. Because there's still a lot of stigma around mental health, and it is not so easy for someone to be vulnerable and come forward and talk about, how they're feeling, how they're coping. When, the reality is life is difficult. We all go through difficult stages in our life, and we have losses, we have breakups, we may struggle with our parenting and juggling that. So it's about normalizing these challenges, and companies play a particularly important role here, because they set, especially the leaders in a company, because they set the tone. What's the work culture like, right? Are we openly talking about it? Do senior managers encourage employees to make use of their employee assistance program or the resources they have in place? And are managers also vulnerable themselves? Because if the managers can't be vulnerable, then of course employees, it's much harder for them as well. If, say mental health is something seen as weakness, as being deviant or difficult, then it's whatever services or resources you have in place, they're likely not going to be utilized. So it's, to round off, it's also important to create safe workplaces where people feel comfortable to talk about their stresses.
Yeah, I think that's a really good point. And there's like many layers to it, but what do you think that actually comes down to? Like, what some actionable things that companies can do to create that psychological safety and I guess break down that stigma?
So I think firstly, it is always we look up to our leaders. So I think it's first of all, it is leading by example. We as our leaders, we need to be first of all showing by example of how it is done, and I think our team members will naturally follow. So at the helm of it, I think it is driven by the leader. But having said that, it is obviously important for each of the individual to balance his or her needs along with the needs of the organization, right? Because I firmly believe mental wellness is about doing stuff that I love every single day. So it is about enabling that for each and every individual and tailoring programs and benefits to cater to the needs of each and every individual.
Yeah. I have to hold myself back. There's so much I can say about it. I think to zoom out a bit, I think you can tackle this at minimum three sort of layers. At the individual level, by giving access to resources, say such as Intellect, where employees in their private time and in their own safe space, they can access confidential mental health services and be proactive about their own care. That's at the individual level. At the manager level, it's about, as I just shared, it's about equipping managers with the skills to have these conversations and these skills to signpost and support their workforce and set the tone right. And then at the leadership level, at the sort of more company organization level, it's about awareness campaigns and how the company position itself and whether you have open dialogue around mental health. These are all very, very important things. You can also look at very practical level. For example, do you have email or Slack like rules when to answer? Do you expect as a manager, for example, do you expect your employees to reply you over the weekend? If you do, you're creating unnecessary stress, and it's probably not a very healthy boundary. Unless you have shift work, it's different, right? But you have to be, especially working across time zones, you need to have very practical, workable rules, how you schedule your meetings. Perhaps you can rotate your team meetings because, so for myself, I have colleagues in Brazil, in the US, in Mexico as well, Europe, India, also in Japan. So basically across the globe, and you can never find a time that works. So inevitably, some people have to stay up late, 10 p.m. or later, but maybe you can rotate things around. So yeah, there's a lot of these more practical things as well. There's a lot of async sort of first communications. I encourage people leaders as well. Do you really need to have that meeting? I think generally, because my anecdotal observations, I think there's a meeting inflation when really the question is, do you really need to have that? Can it be in writing? Now, I do also, of course, realize, especially as a psychologist, burnout is not just workload and working outside these working hours. It's also about not having visibility, not being recognized, and the human connection is also important. So you have to find a balance between all those things. So you must have some meetings, of course, but perhaps be a bit smart how you schedule them.
Yeah, absolutely. And that a connection piece is a big one. So I think we can probably move on to the second section now, which is exploring that like human connection, making sure everyone feels seen, understood. And obviously we all know like remote teams, they are susceptible to loneliness. And I just want to talk a bit about the role of HR and team leaders to bridge that gap. Any initial thoughts before we kind of look at the nitty-gritty stuff?
So see, I think like I already mentioned, right, as HR professionals and people leaders, we are the frontline staff. Although we aren't the therapist, but I think we are the first to observe signs of burnout, signs of employee discomfort in both his individual space and workspace. So it is always about identifying these early symptoms and enabling a culture where we can speak out on such stuff by open-ended conversation, and then referring employees to have support system to improve their mental health. That I think is what is of paramount importance, and that is where I think as leaders and HR professionals we do play a role.
Yeah, I'd say you're caretakers in some way, right? You just said you're not therapists, but actually you're taking care of the employees. It's a very difficult, very taxing job to do as well, right? Because you have to deal with very stressful sort of situations, very KPI driven. You have to manage conflict as well. So you have to also, I'd say, importantly, look after your own well-being. It's the famous sort of phrase, if you don't put your oxygen mask on first, you can't really support others.
Yeah, no, that's a really good point. And actually probably not spoken enough about like the actual HR team themselves. But in general, like, I guess, again, it comes down to those kind of structures of like creating psychological safety and openness. Do you guys have like practical tips on having those like emotional check-ins as a leader, or as a HR leader, or like just kind of like opening up and actually being honest about like, oh, I'm feeling lonely, or like whatever, like how can you encourage people to say that kind of thing?
See, from my perspective, right, there's something that I always practice is that I do have one-on-one connections with my team on a weekly basis as well, where we discuss things outside of work, right? We do have meetings regularly to deal with work related stuff, but I do ensure that I have one-on-one meeting with each of my team members and have a conversation, make it very open-ended, like Oliver pointed out earlier, right? So your first signs of, if you were just to ask our employees how you are doing today, the standard response is, hey, I'm doing great, I'm going about my work. But it's about having those deeper conversations and guiding conversations where I would enable them to open up on how they're actually feeling, and as well as identify if there are any signs of burnouts, and then address them proactively instead of waiting for the burnout to be completed before intervening. See, because I always believe you do not act when your battery is at 1 or 2% full, right? You need to recharge your batteries when you're at somewhere around 30%. So that is the analogy that I use when I identify people who are showing early signs of burnout.
Yeah, I totally agree with your point here. I think that's a must do or must have as a manager, to have your one-on-ones and have as a standing item the well-being check-in at the start. And yeah, not to, as we said earlier, not to brush over the topic, but to really sort of give some space, and also notice when things seem to be slightly off and not be afraid to name that. So, for example, if you notice that, they seem to struggle a bit more and they say it's fine, you can say, oh, I did notice that you seemed a bit tired lately, and that got me really worried. Do you want to talk about it, for example? So to really make that a priority, I would say that's a very important part, but not enough. You also need to, when we talk about burnout, right, it's not just about the workload. It's also about career progression, whether the employee feels seen. Do they feel being treated fairly, considered for promotion? Are they recognized for their efforts? So simple stuff managers can do is, one thing we do at Intellect, for example, we give each other shout outs. On the internal Slack channel, we have a kudos channel where we praise our employees, and then people can chime in, and that's very powerful to create visibility and just a quick acknowledgement to celebrate employees. But on a more sort of regular structured note, I'd say make sure that your employees also progress in their careers. And I can speak as a people leader myself now. I know how easy it is sort of overlooked to focus on the day-to-day, the weekly deliverables, and then forgetting that you also need to look at do you have a competency framework? Is your employee on track to be promoted? Can you support them in their career journeys? And lastly, I'd say, because we're talking about loneliness, I think apart from your meetings and your support as a manager, do create social activities with your teams as well, and make it personal. So one example from my team at Intellect, so we have a Monday morning stand-up where we align on the weekly priorities. We take turns, we rotate for our personal spotlights. So each team member gets 15 minutes and they can share photographs from their childhood, from their family, whatever they're comfortable with, and spend 15-20 minutes to share their journey. And that's been so powerful, getting to know that person, especially for the remote workers, and has opened up a lot of emotions. It's been very, very helpful for internal connection. That is not immediately relevant for your KPIs, but just helps people to connect with each other.
Yeah, I think it's especially important when your like work and home lives are so blurred, and like just feeling like that disconnect between them could be strange, but if like you can bring that together, it's can be really good. You were saying about like making sure employees are recognized, and I wonder if Aditya, you could speak about that from a people analytics perspective, or from like the benefits angle, like making sure people feel properly rewarded and compensated.
So this is talking it more from my experience, right, in terms of how we have designed programs. I think what is so important to understand is your recognitions and rewards need not be large-scale affairs. It can be as simple as having it recognized in front of a team, or sharing a gift card with respect to recognizing an employee's contribution. So these are some of the ways. And like Oliver already mentioned, right, I think historically what we do not do it on a Monday, but I do generally ensure that we call it as Fun Day Friday. So we generally connect over a Friday just before logging off from work. I connect with the team members and typically plan an activity around and give a choice rotationally to the team members to present something or to perform any activity within the team to help the team disengage and get to know each other in a more fashion. In terms of what Oliver was already mentioning, also we also recognize our performers in terms of we use Slack as a channel of communication here at Multiplier. So that's how we form teams, we form and recognize people over teams. So these are some things that we do here at Multiplier and have been done historically as.
Nice. Yeah, I think there's a lot to be said for technology, as much as it does have its downsides, for actually providing that bridge. And there are a lot of interesting ways companies use technology to kind of reduce loneliness or reduce burnout. And Oliver, I'd love to hear more about the AI side, like if you could speak a bit on that.
We have a lot of AI initiatives around enabling our users and employees. Then we have AI initiatives, efforts to support our providers to reduce their workload. So, for example, help them with the case notes they have to do after a coaching session, so it gets automatically transcribed to lessen their load and free up their mental space. And then for the organization, we use a lot of AI to analyze our well-being data from our platform to give deeper insights into, say, for example, burnout, and to spot early signs and help them to be proactive about it. High level for users, the employees, our approach to AIs, we don't think of AI just as single tools you can use, but more as sort of as a layer that infuses your entire experience with us, so that AI gets to know you, of course, only with at a level you're comfortable with, you consent to, but therefore personalizes the journey with us a lot more. So and then signposts you according to your needs. So this is a concept, I think, from the NHS, the UK. It's called stepped care model, whereby a user or a patient, client, they get the right level of care according to their needs. So if someone has sort of severe loneliness, very low mood, clinical anxiety or depression, they get channeled towards clinical care to see a clinical psychologist, for example, because they're in clinical need, basically. But if someone is more, if you look at the sort of the mental health spectrum, more in the green area, so doing okay already, not struggling too much, they would benefit more from more resilience building, say coaching, how can I be a more effective sort of colleague, how can I communicate better, or whatever is relevant to them. So the AI gets to know you, it helps you to create deeper insights into your well-being needs, and then guides you accordingly. So it kind of gets to know you and then kind of journeys with you, if that makes sense. So we have we have a chat function there, and then you can just like I'd say ChatGPT or any sort of AI tool, you can interact with that as well.
Interesting. And I don't know whether it does or doesn't, but does the AI tool take into account like cultural differences in any way, or like?
Yes, it's early stages. We haven't rolled it out in sort of across globally, and it's there's ongoing efforts we have, but that's something I'm directly responsible for as well, to make sure that the data we train our AI, we call them AI agents, is culturally nuanced. I'll give you an example. So we're doing a study at the moment in a university setting where we're testing out whether a school counselor AI agent is culturally nuanced and is perceived as providing empathy and support that is seen as helpful. And so that's in an Asian setting, it's here in Singapore. So the data is attuned to that setting. But if we were to do the same in, say, the US or Europe, we would attune it accordingly, because there's differences around how symptoms for depression, say, manifest, and how people talk about it. Yeah, I mean, in this part of the world, in Asia, I mean, this is very generalized. So, this is not speaking for individuals, but on average, I'd say, especially in older generations, people, when they do feel depressed and lonely, they might not say so. They might complain more about physical symptoms, when actually they're struggling psychologically. Whereas in Europe or the US, they might be more direct. So whatever AI you're using, that should be able to pick up on this.
Yeah, that's so interesting. And then I guess on the human side, like, I don't know if Aditya, you have ideas about this too. Like, what can leaders do to account for those cultural differences and make sure they're picking up on those signs that might be different across different cultures?
Sure. So I think once we obviously work across multiple time zones and countries, right? What it's important to also understand that each of our managers and leaders understand the cultural differences of all of our employees. This is where they're based out of, and also to imbibe techniques of communication and learn and attend trainings to ensure that the messages that we pass out to the individuals are tailored according to their cultural sentiments is very important.
Yeah, for sure. And that brings me kind of to our last topic, which we've touched on a little bit, but that kind of bigger picture stuff, like supporting employees with their lives outside of work rather than treating work as like a vacuum that it obviously isn't, especially in this remote world. So there's so many areas we could obviously touch on here, but I think we can start, and Aditya, I'll turn to you again. Kind of what's the responsibility of organizations to reduce employees' financial stress, and how can compensation packages be tailored in a way that's obviously fair and equitable, and also just relieve some of that pressure?
We as an organization can create those support systems for our employees to manage their overall work-life balance, and as well as create benefit programs that tailors to the needs of the employees. So talking about the financial side of it, I do understand the compensation plays a key role, and as leaders of the comp function, it is our responsibility to create fair and equitable packages on the comp side. However, what we also do is we work with our insurance vendors to create various sessions tailored to on various topics. So these are free for our employees, and they can log into each of the sessions whenever they feel that they would want to hear out topics of their interest. And so we partner with our insurance provider to deliver these sessions. As well as talking about, we do definitely try to look at how best we can tailor our benefits packages given the local governance rules and compliances. But that is something like I talked about. We look at it from a holistic perspective.
I'd like to add one point to Aditya's sharing. I think it's also the organization's responsibility to look at the mental well-being side of financial stress. So at Intellect, we have a holistic well-being pillar. So you can speak to financial well-being coaches. That is not about financial advice, but more about recognizing that financial stress is a key driver of anxiety, and it's about developing healthier habits around money and how you save, but also looking at unhelpful beliefs around money, for example. So, you know, some people might think, they might have a belief, I'm not good with money, and that kind of manifests itself, and then, of course, that creates stress long term, right? So financial stress is a key driver of well-being. So there's a lot you can do outside insurance or actual financial advice, where you look at your beliefs around financials and look at the thoughts you have around money and financial stress.
Yeah, no, that's really true. You've kind of got the two sides of it that you've both identified there. Like, you can obviously use a platform like Multiplier's global payroll platform to get visibility over your data and just make sure actually everyone is being paid fairly, which is obviously the most important thing a company can do. But then there's also the education piece, and it is increasing the company's responsibility, right, to educate people on that. And I think I know you guys probably also have heard about like the increase of like earned wage access, and that's obviously a really good benefit on the one hand, and it also isn't, because it like means that employees get stuck in a cycle of like getting their pay early rather than actually getting to the bottom of these I guess financial issues or thought patterns that can impact them. So yeah, really good point there. Aditya, would you add anything else there?
Oliver talked about, right? I think what we have focused on our benefit programs is always not just on the financial literacy piece, right? So these sessions do cater to how to manage your finances, and you can always go ahead and take the coaching sessions whenever the employee feels like needing on any topic that he or she would want to hear from an expert and learn from an expert. That those options are always available.
Perfect. Yeah, I guess we can kind of round up this session. I just think we should tie everything back and really clearly explore this localized mental health support angle, because obviously that is what both of you are doing, and just look at like what is the best way for a company, let's say they're just starting to expand globally, how can they provide this localized mental health support, and let's look a bit further at Intellect and the kind of tools that are available for that. You can start, Oliver, if you want.
Yeah, so I think it's not really nice to have any longer. It's a must-have, and investing in your employees' mental health and well-being is actually one of the best investments you can make. We didn't speak about this today so much about what's in it for the employer, but of course, if your employees are doing well, if they're mentally well, holistically well, then they're also going to be more productive, and they're going to be more engaged at work, more energized, less likely to leave, and so on. So if you're a global company, I think do look for well-being solutions that are proactive, not only reactive. So that covers the whole mental health spectrum, that provides care that is hyper-localized, so to make sure that your employees have access to coaches and therapists and a helpline in their own language. So there's assurance that the care they get is culturally attuned. You want it to be science-backed, and of course now also AI-powered, but you don't want to replace human coaches, therapists with AI. You want to look out for technology, especially AI, to enable the experience, not to replace humans. I think that's really critical. So yeah, and if you do that, then also make sure that you have the data insights. I think that's something we do extremely well at Intellect, whereby we provide hyper-localized proactive care globally, but we always make sure that there's data insights that are benchmarked against the industry peers on our dashboard, so that you have, as an organization, you have visibility about the well-being of your people. So yeah, it's actually really a no-brainer. So do invest in your employees' well-being, and your company will do better. I'm pretty confident on that.